So now we are going to just do a quick overview of our time here today. So again, my name is Robin Shimwell, and I am the Membership and Events Manager for the National Family Support Network, and I will be moderating today's webinar. So first, we are going to start with an overview and introduction to the Grand Families and Kinship Support Programs. We'll then move on to some information on Family Resource Centers and Family Resource Centers networks. Then we will hear a panel of examples of partnerships and collaboration between FRCs and kinship programs. Then we will give you all a chance to connect with partners in your state and a chance to collaborate through breakouts. We will then go over some resources from the NFSN and from the Grand Families and Kinship Support Network. And then we will end with an evaluation. And again, there will be no Q&A portion of today's time together. So please drop any questions that you may have in the chat. So now I would love to turn it over to Andrew Russo and Anna Beltran to provide the introduction.
Apologies, I thought Andrew was speaking first. Hello, good to join you all today. This is Anna Beltran. I'm the director of the Grand Families and Kinship Support Network, which is a National Technical Assistance Center, and really pleased to be with you today. So why do we use, next slide, the term kinship families and grand families? Good question, but we use them interchangeably. And to mean grandparents, other relatives, and close family friends who raise children when parents can't. These terms have evolved over time, but do want to make sure that you know that we use them interchangeably, because sometimes grand families can sound like we're just talking about grandparents, which we're not. You will see on the two circles on the right that this is national data, but what we do know is there's a good number, at least 2.5 million children, and I'm sure this is very underestimated because it's self-reported data, but that at least 2.5 million children are being raised by grandparents, other relatives, and close family friends without a parent in the home. So these are parents that don't reside in that home at all. And there are many multi-generational homes where the parents may be in and out of the picture. So again, that number is underestimated, but it gives us something. The smaller number is the number of children who are in foster care with relatives. And again, that data is not perfect either because it's state reported data into a national database, and every state reports it differently. So some states consider relatives to include kin, non-related, some don't. So it's a hodgepodge as well. But at least it gives us kind of a roadmap of what we're talking about here. And what we definitely know is that there are many, many more children being raised in these families outside of child welfare involvement than inside of child welfare with any child welfare involvement. So many of these families do not have that system involvement in their life. So there is a lot of work to do to make sure that those families are supported. You'll see there's two links here. Just kind of to general overview pieces for those of you on the FRC side who may be newer to this issue. It's kind of general data and general challenges and strengths of these families. Next slide, please. You'll see that even though that number, 133,000, is much smaller than the other number, the foster care system relies heavily on relatives and kin to care for children who are in foster care. This percentage has gone up even another percentage point since this graph was created. So it's about 35% of children who are in foster care are placed with relatives. And that's the term the feds use, so relatives there. But what we don't know is how many of those 35% are with licensed relatives. And the difference there is if they're licensed or approved or certified or whatever language is used in your state, they get foster care maintenance payments to help meet their needs. But if they're not, they don't. And so many, we estimate, the feds estimate about 97,000 of that 133,000 do not get foster care maintenance payments. So even though there's system involved, child welfare system involved, and they may have easier access to schools and to Medicaid and the like, they may not get any financial assistance either. Next slide. There are a number of reasons, and they look similar inside or outside child welfare involvement. Although inside child welfare involvement, the child should have been removed from the home because of some type of abuse or neglect, but we know that neglect sometimes is just code for poverty. So those children are in the foster care system. Other grand families form, and those families as well who are system involved, child welfare system involved, form because of substance use of the parents, which can lead to abuse and neglect. The parents have died. The parents are disabled, maybe so severely that they can't do the day-to-day parenting. They've been detained or deported. Some kind of adverse immigration action has sent them back to their native country and they cannot parent. They may be deployed in the military. They may be in jail. And of course, we know that COVID-19 increased the families. Again, no great data there, but we know it. We know it from all the anecdotes and all the stories that we've heard. But the primary reason that these families form tends to be nationally because of some type of alcohol or substance use. But I know the individual states that we're going to hear from later have causal factors that tend to occur more in their communities or less in their communities. But this is a big general overview, and I'll let them speak to their communities. Next slide, please. So why do we want to put children with relatives? And why do we want to encourage the children are placed in grand families and kinship families? Because the children thrive. And this is decades of research summarized in this pretty infographic, some of which is very common sense. You know, they maintain better connections to their family, to their culture, to their roots, to their siblings. Others of it is less obvious, but the data shows, the research shows that they tend to have better mental health outcomes, experience more stability, more permanency. So just a lot of positives and a lot of reasons why we want to help support these families. Next slide, please. So who are we at the Grand Families and Kinship Support Network? Well, we're about a week away from celebrating our 2nd birthday. We have a 5-year cooperative agreement with the Administration for Community Living. And it's the first ever federally funded technical assistance center on the families. And I say on because we don't do direct service. We don't help the families directly because you all do that best. You know your communities best, your state laws, programs, etc. best. But what we can do is elevate great practices like what you're going to hear from today, and great programs that you can replicate, that you can learn from, because as any kinship caregiver will tell you, services so depend on where they're lucky enough or unlucky enough to live. And we want to remedy that. We want to see services and supports throughout the country. Next slide, please. These are 3 of the kind of key things we do. We host webinars. We respond to individual requests for help. And this is an important thing. So if you click on that, when you get these slides, it'll take you to a form and you can ask any kinds of questions. And we have a team that will answer those. And a cadre of subject matter experts to rely on if we don't have the answers. So everything from who's got a great Kinship Navigator program that's been approved for Title IV funding to how do you do outreach? How do you find these families? So reach out, it's all free. And we have a monthly newsletter. This month's is going out today. If you'd like to sign up, you'll see the link there and the QR code. And again, you'll get these slides, and I think Melissa has dropped it into the chat, so you can just do it right now if you like. And you may get today's newsletter because I don't think it's gone out yet. Next slide, please. Just wanted to share a couple of resources with you. We have grand facts fact sheets for every state, for several tribes, Puerto Rico, DC, Virgin Islands. And these are meant for the caregivers so that you can use them and share them with them. They're all in Spanish except for the tribal ones. And they have contact information. They should list your family resource center if you're doing these services. And if they don't, please reach out to us and we will add it. Next slide, please. And then we have over 80 resources on our website. We've developed in over 30 this year, all kinds of tools there for you. But this one I wanted to elevate because it really talks about the importance. And we do it at the network. They're on our management committee, folks with lived experience who've walked in these shoes, who know the issues the best, know the issues the firsthand, and really kind of steer our course and review everything we do and are instrumental to our work. And so this is a tool to help others do what we've been able to do. So please, I look forward to hearing from the states, and please stay connected with the network, and I will turn it over to you, Andrew.
Great. Thank you so much, Anna. So glad to be here and have the opportunity to co-host this connecting session with you. So to provide some additional context, now that you've heard about kinship families and grand families, we'll talk about family resource centers. So family resource centers have emerged organically across the country. They may be in community settings, like the image you see on the left in Vermont, or they may be school-based, like the image you see on the right from Kentucky. Yet as they have emerged organically, many people don't know about them. So we often refer to them as America's best kept secret. Next slide, please. Family resource centers may be in rural areas, like you see in the image on the left from Colorado, or they may be in urban areas, like the image you see on the right from New York City and the Bronx. Next slide, please. But wherever they are, family resource centers work with families with an approach that is multi-generational, strengths-based, and family-centered. All of those are key. They are designed for all families. So not only families who are facing a lot of challenges or low-income families, designed for everyone. The image you see on the right comes from New Jersey. New Jersey has 21 counties and 57 family success centers. That's what they call family resource centers there. So that includes very affluent counties as well as highly challenged counties as well, because the idea is everyone should be able to access these supports, that all of us could use support with two of the most important roles that we have as adults, being parents or being spouses or partners. Two of the most important roles we could have that we typically receive nothing in the way of support and guidance for. So here are family resource centers, family success centers here to help. So the fact that they're for everyone also reduces the stigma of people accessing supports and services for FRCs. They provide services at no cost or low cost for participants and support families to build protective factors. Next slide, please. Such as these protective factors that come from the Center for the Study of Social Policy. These protective factors, they determined through research in 2005, were most likely to ensure that a family was healthy and strong, less likely to experience child abuse and neglect. So all family resource centers work with families to help build these protective factors. As we know, they make a difference. Next slide, please. Family resource centers bundle together in one convenient location many different supports and services that may be familiar to you already, such as home visiting, parenting education, childcare resource and referral, fatherhood programs, food banks. Bring them together in a convenient location that families can access in the community. Next slide, please. We often say if you've seen one family resource center, you've seen one family resource center, because the supports and services that they develop are directly related to the opportunities, the needs in given community where they're working. At the same time, we also know, thanks to research conducted with the support of the Robert Wood Johnson Foundation in 2015, 2016, that there is actually remarkable commonality across the most common service areas for FRCs. And those are parenting support, which is this long continuum from lighter touch to more intensive services. Also, access to resources exists along that continuum. Child development activities and also parent leadership development activities. So the first two, parenting support and access to resources, we talk of those as the bread and butter of any FRC. So any FRC, big or small, urban or rural, school-based or community-based, provides parenting support and access to resources. This is particularly key in this context of today's session, where we're talking about grand families and kinship families, because so many times those families are looking for resources. And here are programs that are entirely designed to provide resources. Next slide, please. It's also important to understand that family resource centers are not just a list of programs or services, but they create communities. They create social connections or peer support, where parents, grandparents, caregivers who participate in the center are joining with others and breaking isolation, connecting with others, building those social connections that we know make a huge difference in terms of families feeling less isolated, more connected with others. Next slide, please. So now that we talked about family resource centers, going one level up, just to mention that there are also networks of family resource centers, and many of those are represented here today. You'll be connecting with each other later on during this session. And we define a network as 2 or more FRCs coming together. So 2 or more FRCs coming together is a network, and they work together to ensure coordinated quality support for families. Next slide, please. So this map gives you a sense of where those networks are. When we first started in 2011, there were just 8 states on this map that not only had invested in FRCs, but had created networks of them. And now we're up to 39 member networks here. It has come a long way in the past 12 years. Representing more than 3,000 families, representing more than 3,000 FRCs that work with millions of our nation's families every day. So with that, turn things back to Robin.
Thank you so much, Andrew and Anna, for providing the introduction for our session today. Now, I am very pleased to introduce 3 of our panelists today that will be presenting their successful collaborations between FRCs and Kinship. First, we'll have Carol Lipinski from Arizona. We'll then hear from Victoria Ragosa from Kansas. And finally, we'll hear from Shelley Willis in Washington State.
Thanks so much, Robin. So glad to be here today to be sharing a little bit about the Kinship work that we've been doing. I am a consultant. I've been in consulting for about 6 years. My area of passion is family support and child abuse prevention. I've been working for many years developing responsive programming to support families in their journey. Most of that was at a private nonprofit and executive leadership and developing programs. And a few years was at our early childhood organization in Arizona called First Things First. My areas of passion at the most top is family resource centers, then early childhood home visitation, parents as teachers and healthy families, collaboration and leadership development. Next slide. So I wanted to give you a little bit of information about Arizona. We're still in the Wild West out here, and one of the new baby states is as long as compared to others across the country. Arizona has 3 urban hubs, Phoenix, Tucson, and Flagstaff, with Phoenix being in Maricopa County, which is, it's rather large. It's bigger than some states. 4.6 million people live in that one county. Arizona as a state has 7.5 million people, and it has been for many years the fastest growing state in the country, and the 4th largest county is Maricopa County in the country. Mesa, where our organization was located, is the 3rd largest city in Arizona with 521,000 people in that city alone, which is again almost bigger than some states. So we have some very interesting geographics that we have to pay attention to. With those only 3 urban hubs, we are mostly rural, and we have a lot of tribal lands. We have 22 tribes in Arizona, and we also have a large urban tribal community. Maricopa County itself kind of divides itself into 3 sections: Central Phoenix, East Valley, which is a group of cities, and West Valley, which is a group of cities. All right, Child Crisis Center, which is the organization I worked with in Mesa, had a family resource center, which was all free. We served families prenatally to 12, with collaborators coming on site and providing services for children and families 12 plus through the lifespan. Let me tell you a little bit about our programming. This is a snapshot of what we evolved to after 10 years of developing our work from 2000 to 2010. Most of the families that we served were non-DCS involved families. And as Anna shared, our number one reason for the families being kinship and relative families is because of substance abuse. And then all of the other reasons kind of fell out from that with incarceration, co-occurring disorders with mental health and substance abuse. The parent may be completely missing, or that there has been a death in the family. Our program started about 10 years into the development of our Family Resource Center. We started with a grandparent who was 40 years old. She was going back to school for her bachelor's degree, and she ended up raising her young grandson who had some special needs and was removed by his mother due to, at the time, substance abuse. She was in her Bachelor's of Social Work program and actually became my student intern. And her first internship project was creating a drop-in support group for these grandparents raising grandkids. And at that time, it was a once-a-month thing. We were still figuring out what this meant in the early 2000s. Aurelia, who was our staff person, started leading that group. And as she got her BSW, we decided to hire her full-time to run our kinship program, which involved a lot of different things. So I'm just going to talk about a few of those. As you can see on this schedule, we had a parenting class. And if you skip down a little, we had a drop-in support group. That drop-in support group and that parenting class over time became an 8-week rotation. The support group was always on the same Tuesday of the month. And then the cycle of that parenting class ran around that. The topics that were taught and shared in those parenting classes were determined each session by the grandparents and relatives raising the grandkids, so that each session had different topics, and we brought in collaborators to talk to those topics and share information. We had a guardianship clinic, law clinic. We had a lawyer who donated 2 hours a month to supporting these folks, and he provided free 15-minute consult sessions to help them with their challenges and their court issues. We eventually added a kinship kids group. We had a class in our regular FRC programming called Raging Rhinos and Growling Grizzlies, which were anger management classes for kids to teach them anger management skills. But these kids needed that class and in addition, this additional class because of the challenges they were experiencing due to their specific situation in being raised by their relative and their parents. We eventually added some adoption and foster care groups as well when a adoption and foster care organization merged with us. Next slide. You know what? Go back one. My bad. Not shown on here were just some other wraparound services that we provided in our relatives and as parents and kinship work. We would go to court with some of these families and support them. If they had a DCS case, we would support them going to their MDTs. We would, when these families became a grandparent, we would give them supplies and supports to help them as a new parent. And we would take them down to the legislature to advocate. Next slide. So we strongly believe in collaboration. We collaborated with our families. We worked with those who had the lived experience, including hiring them to support us. They drove our programming 100%. On the agency level, within our own agency, we had an emergency shelter, we had adoption and foster care, a thrift store, home visitation, so we could provide those services to those families as well. There were 3 agencies in our county that were really the leads in providing this work. One was in the West Valley, one was in the East Valley, that was us, and one was in Central Phoenix. And we worked very closely with each other to be resources to each other, refer families to each other. And we really didn't have any competition. We just wanted to support the families. We helped found a Central Arizona Kinship Coalition, which was for Maricopa County and the close surrounding counties. That still exists. And Aurelia, who was our original staff person, now works for Casey Family Programs and actually is the chair of that coalition. And then on the state level, we supported and worked with a statewide ambassadors coalition that really was bringing all the coalitions across the state together. Last slide. And we strongly believe it's how we work together that makes this happen. We can't all do this alone. We need each other badly. And thank you for letting me share.
Thank you so much, Carol. We will turn things over to Victoria Ragosa.
Hi, everyone. My name is Victoria Ragosa, and I am the supervisor of the Kinship Navigator program here at Kansas Children's Service League, which I will also refer to as KCSL. Just to give you some background information on KCSL, we are a statewide nonprofit organization that focuses on child abuse prevention. Our mission is to protect and promote the well-being of children. KCSL has been serving children and families since 1893, and our programs are shown to break cycles of neglect, abuse, and trauma. Next slide, please. These are some of the programs offered at our Wichita Family Resource Center. KCSL does have a long history of providing case management, coalition building, collaborative partnerships, and collective impact projects. Our FRC is located in the 67203 zip code, and this zip code is currently the 6th worst zip code for health disparities in Wichita. The worst zip code for health disparities is adjacent to 67203, and that is a heavily Hispanic demographic area. So these vulnerable populations are struggling to access healthcare, housing, food, and other concrete support items. The KCSL office can help bridge this gap for families, having recently become a family resource center. We have established agreements with 6 community agencies that will help with concrete supports for our families being served within our organization. The 6 agencies that have partnered with us will help to resolve any child care issues. They will help with housing, legal aid services, unemployment services. They will help with food boxes for our families, and then they will also help with healthcare services. Essentially, our Family Resource Center is a one-stop shop that is working to provide customer care coordination to an additional 100 walk-ins a year, and we have 3 areas that we're working in. We're working to direct referrals to our KCSL programs directly within our building, which is already serving 471 families. We are also working to provide referrals to external agencies within the community. And then we're also working to provide access to concrete support items that families desperately need, such as diapers, wipes, formula, clothing items, basic toiletries, and kitchen items. In every department of our Wichita FRC, there is at least 1 bilingual staff member available. And we are also accredited by Prevent Child Abuse America. Next slide, please. Our Kinship Navigator program is funded by the United Way of the Plains, and we began receiving that funding in 2006. The grant year currently runs from July 1st to the end of June, serving 8 counties, which consist of Sedgwick County, Butler, Cowley, Harper, Harvey, Kingman, Reno, and Sumner County. We currently are a strength-based model, and we have 3 outcomes that we are focusing on. The first outcome is increasing family functioning. The second one is to prevent children being placed in state custody. And the third one is to follow up with kinship families 6 months after their case closed to ensure that children are either still in the home in a safe environment or that they have reintegrated with their biological parents. After a case typically closed, our kinship navigator has a continued communication and support for families even after gaining legal guardianship. In Sedgwick County, which is the Wichita area, the Kinship Navigator Program is the only program offering case management services and family support to kinship families who have children that are not in the foster care system. The most common reasons that we see individuals needing kinship care or caregivers reaching out in Kansas would be substance abuse, mental health, incarceration of caregivers, parental death, and child neglect, and sometimes even a combination of all of those things. Next slide, please. According to the most recent Annie Casey Foundation's Kids Count Data Center statistics, there are approximately 2.5 million children living in kinship care, and I think we may have seen this slide before in a different format. In the state of Kansas, it is a little bit higher than the national average, and we're at about 4% here in Kansas. Since taking in new children can be costly, the Kinship Navigator Program, we do have a really close relationship with our legal aid here, known as Kansas Legal Service. And we also have private attorneys that are working with Kansas Children's Service League to help families gain guardianship of children at a reduced cost. Attaining legal guardianship helps support children that are living in kinship care and ultimately lowers the money spent on them going into a foster care system. The Kinship Navigator Program is very successful at mitigating the effects of trauma while also keeping families together. Last fiscal year, the program's goal was to serve approximately 40 families. Our Kinship Navigators served 47 families consisting of 71 children. Our new fiscal year began as of July 1st. Next slide, please. And here is my contact information if you'd like to learn more about KCSL, or if you have questions about our Family Resource Center or specifically about our Kinship Navigator Program. Thank you.
Thank you so much, Victoria. And now we will hand things over to Shelley Willis.
Thank you. Hello, everybody. My name is Shelley Willis. I'm a mother, a kinship caregiver, and the director of a nonprofit organization serving about 20,000 families annually in a tri-county area of Washington State. We are recognized as a family resource center, and we did expand our services to incorporate kinship care, and I'm going to share that with you in a minute why. But this photo is of our locations. The first one is in Tumwater, Washington, very close to the state capitol. And each of our offices is embedded and collaborative with other organizations. So in Tumwater, we are next door to the TANF Welfare Office. We are downstairs of Child Protective Services, and we are across the parking lot of the Health Department. The middle picture is our Lewis County office, and we are embedded in a Northwest Pediatric healthcare organization. And the last one is our Mason County office, and we are embedded in a transit facility where we share space with United Way, Boys and Girls Club, and Big Brothers Big Sisters of Washington. So we believe in collaboration. Next slide, please. We have a variety of evidence-based services that we offer, and they range from a home visitation program for women who are pregnant and addicted to fatherhood classes, relative caregiver services, of course, and peer programs, all kinds of parenting, divorce, domestic violence, mainstream prevention, all kinds of parenting programs. We started getting a lot of calls from parents about 3 years into our provision as being a family support center, and they sounded something like this. I have just a couple I'm going to read to you. I'm 82 years old. I have one son and one granddaughter. My son has complicated medical needs. My granddaughter is deep in addiction. My son brought a 7-month-old baby to my door and said, "This is your great grandson. I'm going to jail." And there we were, 82 years of age. Here's another. My husband and I are a few years away from retirement. We chose to never have children. 10 years ago, our twin great nieces needed a place to live, and we had a family meeting and were chosen by the whole family to become their guardians. Retirement began to look a lot different than what we had planned. There's one more, two more I want. I got a call from Yakima. So for us, that's on the other side of the state. And there's a baby in the hospital that is now my grandson. I didn't know I had a grandson. I hadn't seen my daughter for 2 years. They told me if I didn't pick up the baby within 24 hours, he would go to foster care and I might never see him again. So I took a bus to Yakima to pick him up. On the way back, I realized I had no idea what his name was. And the last one, which is representing a greater population, we're seeing more and more. I'm a 25-year-old. My wife and I have a 4-year-old son. Last month, I got a call and I was told that my mom had passed away and my dad had deserted us. I have 5 siblings. Will I take them? How could I say no? They're my family. Suddenly, I went from a family of 3 to overnight having a family of 8. Our apartment manager told us we were beyond the population they could accommodate. So these were some of the calls that we were getting, and we realized that we needed to amend our service delivery to address this growing population of folks. And we did some research, and what you see on the screen now is what we learned, that kids do better when they're placed with family. They stay in school for longer periods of time. They don't have as much moving happening. The culture and traditions are more likely to be consistent. They're more likely to see their siblings. All of those things in place make that transition happen much smoother for the kid. Oh, by the way, 85% of the families that we serve in relative care have those kids because of addiction. So next slide, please. Services we offer to relative caregivers are on the right side here. We have legal aid, emergent financial aid for those who fall 200% below poverty guideline. One time, once a year, we can give them about $1,000 to mitigate service for that child. So a bed or school clothes or whatever it is needed. We have case management, and at our organization, we have 3 ongoing research projects going right now. One of those has to do with kinship care. We're working with the University of Washington in an evidence-based case management model that is in the clearinghouse for review, and we hope it will be cleared this month and shared with others across the US. It's certainly working well for us. But right now we have this case management. We also have information and referral. And I'll tell you, when you operate a family resource center, you know, people are happy to come and get supports. They want to come to parenting classes. They want to leave their kids with you. Relative caregivers are a little different for us. They're a very discerning group, and they'll question, well, who's the child care worker? How long have they been here? Have you run a background check on them? And I'm not sure I want to leave my kid in your care anyway. Can we take them in the support group meeting with us? It's a very discerning crowd, and we had to modify our service delivery to better accommodate that. We have, as I mentioned, legal resources. Support groups happen weekly during the day and at night, because we learned earlier on, not all relative caregivers want to drive at night. They have a harder time navigating traffic. And we have holiday support, and that's throughout the year. So whether it's Thanksgiving or Christmas or Easter or Kwanzaa, whatever it is, we have something happening. We have youth and teen support groups. We have quarterly intergenerational activities, and we do advocacy training for all of our parents and relative caregivers, and hold an annual advocacy day at our state capitol. And we provide all kinds of training, divorce, domestic violence, and parenting the second time around, all of that. What we found in providing our Family Resource Center, adding kinship was just a natural branch of the services that we offered, and helped to leverage quite a bit of resources. We had served a lot of family and youth serving organizations. We'd partnered with them, but now we were partnering with senior serving organizations, aging and disability services, senior services, and it enriched our resources, our contacts, and our connection to our community. Leverage donations. When you're a relative caregiver, sometimes you have to move out of senior housing because they can't allow children in that facility. There were issues that we had to face that we hadn't looked at before. We also recognized that children of color were disproportionately in our system, in our legal system, in our child welfare system, and we wanted to serve these families. It was an underserved population. Average caregiver is about 58 years, and what we've learned is that's going younger. So as I mentioned in the story I just told, we're seeing more and more siblings taking on the care of their relatives. Nearly 3 in 10 children are reported having a disability on average. It goes, which is about 28%. It's a higher ratio for those in relative care. It's a higher ratio of kids in relative care have had trauma of some kind. You don't go live with a grandma because things were going well. Usually there's some sort of trauma. Anna did a great job of talking about all of those reasons. Thank you. Next slide, please. So one of the ways we get the word out about relative care and the needs and barriers that they face is by an annual advocacy, hosting an annual advocacy group at our state capitol every year. This year, we had a specific ask to bring in an additional $2 million to help increase the emergent financial aid we could offer folks to increase the number of navigators across our state and to expand their pay. So we had originally about $75,000 per navigator offered, and this was allowing an increase of to about $130,000. So we did get the funds, but it took us really advocating for it. And this was one of the documents we used to inform our legislative folks. Next slide, please. I've also incorporated slides that show you our advocacy day. So this is the flyer that invites folks to join us, and you'll see us there with several of our legislators. We offer lunch and have them come listen to stories of kinship care, and it made a huge difference. We started inviting legislators to our support groups, and we sort of had a hidden agenda. We wanted them to talk to us about their big issues, but we really wanted them to learn more about relative care issues. It made a big difference for us. Next slide, please. This is a statewide kinship advocacy group. So the reason I incorporated, I'm here at the top, but what you can really see is our governor and first lady. They contribute, they help recognize our annual advocacy day event. They come to it. The first lady comes and helps us serve lunch. It was very important for us to hold this statewide discussion. It holds not only relative caregivers, but all the people who influence that population. So we have about 140 people who meet monthly and talk about kinship care, including our governor and his wife. Next slide, please. And then we do everything we can to keep kinship a live discussion in our community. You know, funding comes in fads. If you work in nonprofit, people get excited about one thing and then they move on to the next thing. And we want relative care to always be at the top of the discussion. So we hold health and resource fairs. We work very closely also with our tribal nations. We have 5 close to us, and other pockets of the community like YMCA, Hands-on Children's Museum, schools, and we hold resource fairs. We hold them in different languages. We have a Latinx resource fair. We have African American resource fair, and we have a Native Indigenous resource fair. We have walkathons, and we hold quarterly intergenerational events, which are often kinship picnics. And we have Zumba. You can come Zumba with us every Thursday night, no matter what your age or ability. And we also launched, and there'll be another slide in here, something called Parental Compass. It's hard sometimes for relative caregivers to find childcare. And so we wanted to have information that they could access at any time available to them, and they didn't have to leave the home for it. So we created these miniature podcasts, and we have over 200 of them. They were very popular in COVID, but still remain popular. In fact, we're in the top 5 for Holland. For some reason, Holland loves our podcasts, but they're free, and people can log on to our website and access any topic, any little knowledge base they want to explore. Next slide, please. Inoculation is the word we use. Yeah. Parental Compass is an inoculation, and it's free. Next slide, please. Then we also provide training and support for people like us across the state. We work with our aging and disability program, and we talk about issues relevant to those who are hosting support groups for relative caregivers, who are serving them in a case management way, or they themselves may be a kinship navigator. We serve about 150 folks who sign up to take these trainings, and also school teachers come to this, judicial officers. The last three we did, we were talking about trauma and resilience. I'm sure you're all aware of the mental health issues facing our kids today. LGBTQ plus and suicide became a real issue for us in the past 2 years. We had 2 9-year-olds commit suicide within 1 month, and we were able to find a couple of strategies that have made a big difference across our state. Next slide, please. We make sure we say thank you. We do it in a lot of different ways because, again, we want to keep our attention high on relative care. So at the bottom of this, you see a picture of my core team of folks. And then you'll see people donating diapers, and we take a picture of relative caregiver kids, and we send them a thank you and say, please keep doing that. We host an annual essay or contest where kids can write in poems or essays relating their experience in living in relative care. It's called Voices of Children. And there's a picture of it here. And so we get between 50 and 150 essays every year, and we publish them into a book, and we share it with everybody, elected officials, relative caregivers. It's a tearjerker, like a chicken soup for the soul kind of little book. And we put them all in here. And this past 3 years ago, we started adding relative caregivers themselves. So we started having the stories of the grandmas and the grandpas and the siblings. It's a very honest look at the joys and challenges in providing relative care. You can find it for free on our website. This is our 20th year, and we're going to keep on doing it because it keeps getting us at the front of the line to talk about needs in our community. Thank you. And here's who we partner across the state. And I just want to encourage you to partner locally at statewide level and nationally. We work with all of the local businesses. Everybody's related to somebody doing relative care. Boys and Girls Club help us get free after school programs. We get YMCA passes for relative caregivers, tickets to the Hands-On Museum, the zoo, all of that stuff we can share with relative caregivers. At the statewide level, we're very engaged with those going up for election, and we hold forums and say, how are you going to support relative caregivers in the next 2 to 4 years? We work with other nonprofits, businesses, schools, tribal partners. And at the national level, I'm a huge fan of Anna Beltram and her organization, Generations United. Casey Family Programs has been great and has great data that helps us tell our story. US Aging and the Brookdale Foundation, phenomenal. AARP helps us get tax work done, support relative caregivers in filing their taxes. Great partners. I just encourage you to reach out to them. Last slide. Thank you. Did I make it on time? It was quick. Thank you very much. I'll put my information in the chat if you need any more, if you have any more questions.
Thank you so much, Shelley.
Mm-hmm.
All right, and now we are going to hear a video from the New Hampshire Network.
So thrilled to be here and to talk about New Hampshire and what we're doing in the state, particularly in this case with the Kinship Navigation Program. So just to give you an example of where the New Hampshire Children's Trust has come. We've been in the state for a long time. We've been partnering with our family resource centers for a long time. In 2019, we actually changed the structure of the way that we work with family resource centers so that we're now the designated facilitating organization for the Family Resource Center network. And that has allowed us to increase our total budget, including pass-throughs to the FRCs, from a budget of about $300,000 in 2018 to in 2022 upwards of $6 million, and we are still climbing. So that's been great. I do want to focus on the Kinship Navigation Program specifically. So in New Hampshire, the Kinship Navigation Program is free, it's voluntary, and it's open to anyone, grandparents, relative caregivers, and fictive kin who are raising a child or children in the absence of the child's biological parents. So some of you might not be familiar with the term fictive kin. Essentially, fictive kin are anyone who is not directly related, but knows the family, knows the children. So it could be a neighbor, a friend, a teacher, etc. And the Kinship Navigation Program supports all of that entire population. So the Kinship Navigation Programs essentially fills a gap. So children are either with parents, or if something goes awry, they might come to the attention of the state's child protection agency. The Kinship Navigation Program essentially fills the belief that children, if they cannot be with their parents, are often better off with relatives, family members, or people who already know them and are familiar with them and their families. I will also say that of all the different, whether it's grandparents, aunts, uncles, fictive kin, people in New Hampshire who are participating in the Kinship Navigation Program are in fact grandparents. So the Kinship Navigation Program is available statewide. For those of you who might be familiar with New Hampshire, the northern border is adjacent to Canada, and there is not much population up there. So most of the sites are in the southern part of the state where there's much more population. So because the family resource centers are located statewide, but they're also very specifically embedded in their local communities, they do a lot of building and offering of programs that are specific to what their community needs. The Kinship program is one that is statewide. Every family resource center has at least one Kinship navigator, and in many cases they have more than one. So the role of the Family Resource Center is to collaborate, to coordinate program delivery, to provide support groups and training for staff, do outreach and promotion about all the various programs that they offer, develop community partnerships, and collect data so that we know what is working well and where improvements are needed. So the role of the Kinship Navigator then is to work directly with the Kinship caregivers, right? Providing emotional support, education, guidance, information, referral, and follow-up. As you'll hear from Cheryl, sometimes kinship caregivers are not anticipating becoming a kinship caregiver, and there's a lot that they don't know about and are not connected with, and so that is their role. All of the kinship navigators in New Hampshire are coordinated through a central kinship navigator program manager who provides a community of practice, retreats, and a technical assistance for the kinship navigators that are working directly with the families. So we offer the kinship program through a fairly intensively braided series of funding sources. So the kinship program is supported by the state of New Hampshire, Department of Health and Human Services, Bureau of Economic and Housing Supports, Department of Children, Youth and Families, CDC, the Governor's Commission on Alcohol and Other Drugs, and the whole thing is administered by the New Hampshire Children's Trust. I will say, just last year, we also started using a portion of our CBCAP, community-based child abuse prevention funding, to provide some funds to the family resource centers to use for concrete supports, funding that might be needed by the kinship caregivers, and that has been very well received. I just want to give you a little bit of a sense of this current scale and scope of the program. So Since the inception of the program, which was in July of 2019, it was initially rolled out as a pilot, and then was rolled out statewide in 2020. So there have been 632 families, kinship families, that have been referred, including just under 2,000 family members. And here you can see that roughly half of those families are currently enrolled in the program, and another 219 received services but have since been discharged from the program. We also track what some of the causal factors are. So if there's a kinship placement needed, what is the contributing factor behind that need? And this is some of the data that we have around that. So the vast majority of placements are due to a substance use disorder in the family. Almost 82% of a kinship placements are for that reason. In some cases, one or both parents are incarcerated, more often the father, sometimes the mother. Vanishingly small number of are both. We also track whether parents are deceased. So it could be the mother, the father, or both. And in terms of DCYF involvement, roughly 40% have had no involvement with DCYF whatsoever. Roughly 25% or a quarter have an active case, and the remainder have a closed case. So that's just a little bit about the Kinship Caregiver Program and the way that it's organized and structured in New Hampshire. So thrilled to be here and to talk.
All right, so now you have heard various examples from across the country of ways FRCs are working with kinship and grand families. So we heard from individual program examples in Arizona, in Kansas, and in Washington State. And then we ended with looking at a systems level example where the entire network of FRCs in New Hampshire is leveraged to support kinship navigation. So we've come to the exciting part of this session, which is the connecting part, where in just a moment, we'll be opening up breakout rooms for all the states that have networks of FRCs represented here today, which is not all of the states across the nation, but is most of them. So you will see breakout rooms being opened shortly that then we'll ask you to navigate to help connect dots with both those who are involved in kinship in states and those who are involved with FRC work in states, getting to know each other, introducing yourselves to each other, and checking in about if there are ways that you might connect further. So to help with that, we will also chat out a link in the chat now. That link will be to a recording tool that we will ask for the FRC network representatives to take responsibility for filling out that chart in their rooms. So that we chatted out there. There it is. It's a Google Sheet there. So when you click on that, you'll see these questions that are in the chart format and ask the FRC network reps to take responsibility for making sure that's filled out for your state. Now, if you're from a state that isn't represented with the network, we do also have some general discussion breakout rooms if you want to connect with others through those as well. So we're going to give you 18 minutes for this, 18 minutes to connect with each other and start connecting dots. Are there any questions before we send you off to your breakout rooms? All right, so those breakout rooms have opened. So please go on your, and you might see in the toolbar the breakout rooms section, which has 4 squares on it. And if you click on that, you'll see the various breakout rooms that have been set up, and you can navigate to the one for your state.